Sometimes parents are worried about their child having perseverative behaviors, that is, repetitive movements over and over and over and over. And so they worry, is that a sign of autism? The answer to the question is it depends, because there are 14 criteria for autism spectrum disorder, and a child needs to have 7 of those criteria to be within the spectrum of autism spectrum disorder. So if the only behavior that a parent sees is the child being repetitive, perseverating on looking at their fingers if they're 9 months old, or if they're 1 or 2 years old, lining up their cars, lining things up instead of playing with them, that is not enough to diagnose a child with autism spectrum disorder, because that is only one of the 14 criteria. Now, I have experienced in the 4.5 years I've been here that there are times when a child will be sent to our center who has been misdiagnosed as being autistic with only having 2 or 3 or 4 symptoms, or what we call signs, of autism spectrum disorder. And so the doctor will put in his note to me that the child has mild autism. And of course, this is very distressing to parents. However, it is not accurate. If a child has 2, 3, or 4 symptoms, or signs, we call them, of that which fits into the autism spectrum disorder, that is not enough criteria to meet the diagnosis of mild autism. Now, I've heard some doctors even call this atypical autism, and they'll send a child to me and the child has maybe 3 behaviors that meet the criteria for autism spectrum disorder. But again, 3 criteria like perseveration, doing repetitive motions, avoiding eye contact with adults, and not talking yet. That's only 3 criteria. If the child doesn't have 7, then it's not autism spectrum disorder. It's more probable another factor related to genetics in the family tree. And the most common cause would be obsessive compulsive tendencies. So the second most common cause is if when a baby initially discovers their fingers and starts studying their fingers, wow, look at those things in front of me, and the parent slaps them or pushes their hand away, that is no different from the child who's sucking their thumb and being told, stop sucking your thumb, stop sucking your thumb, stop sucking your thumb. It'll reinforce the child doing it more often, which leads to support for obsessive compulsive tendencies running in that family. So when we try to diagnose something as complex as autism spectrum disorder, we have to remember that the minimum number of criteria is 7. And things like walking on your toes is not a diagnostic criteria for autism spectrum disorder. Just things like repetitive behavior, like we call perseveration, and avoiding eye contact with others, and not yet talking are 3, but that's just 3. A child needs to have 7 of the criteria to meet the diagnostic criteria for mild autism, not even moderate or severe autism. So, one needs to consult an expert to get an accurate diagnosis rather than jump to the conclusion that a child has something that is not even a high incident disability. Thank you for listening. Parents often wonder why, if a child doesn't do something the first time they give the child a command, that they should repeat the command 1 or 2 or 3 or 4 or 5 more times until the child completes the task. However, repetition of using language to get a child to do a task that you already told him one time to do actually conditions a child to not be responsive to the initial verbal cue. So the reason for not repeating yourself is to protect the child's understanding that language is important, and only one time the message should be sent to the child verbally. If the child does not respond, immediately facilitate hand over hand the task you want the child to do in first person singular. Thank you for listening.